Hello, welcome. My name is Rick Aceto. I am a faculty instructor here, and I wanted to welcome you to UNM-Los Alamos, and I'd like to take a moment of your time and give you guys a virtual tour of our classroom and facilities. First, I wanted to start out here at UNM-Los Alamos. We offer 3 levels of licensure. The first one being emergency medical responder. The EMT, which consists of 180 hours over a course of a semester, and then we move on to the AEMT, which is an advanced emergency medical technician. Our main goal here at UNM-Los Alamos is to give a high fidelity practical approach to prepare you for the next level, but also to prepare you for field work, whether you choose that to be in the pre-hospital setting or the clinical setting, wherever you are within the state or region. So first of all, this is kind of the classroom. This is where the didactic portion, book work, lectures, kind of the standard, what you would think of a classroom, college classroom. Over here behind me, this is just one of our giant big screens. And as we slowly kind of pan around the room, you can kind of see how the seating usually is, as far as the lectures, how the lectures are set up. Very, very dynamic class, as far as it's not your typical math class or science class where you're sitting listening to a lecture. A lot of the times you're doing teaching points, and then we kind of get up and move around, get the blood flowing, and then introduce a skill, and then we kind of move on. Behind us here, you kind of just a typical dry erase board. Again, you'll be utilizing this. Your instructors will use this. This is a kind of, nothing special here, but the one thing a lot of times we'll write our homework assignments on, and then we kind of break down what we call drug cards, pharmacy cards. It's a lot in a short amount of time, so we try to give you the best opportunity to succeed. And over here, this is in the classroom. I know it's mentioned this was for lecture only, but this is one of a prop, if you will. This is supposed to mimic a small sedan compact car. As you know, in the pre-hospital setting, there are motor vehicle accidents. That's part of your trauma didactic period. But here, we'll actually, as students, we'll actually kind of have you sit in here, play the victim or the patient, and then your other students will come in and kind of extricate you. This thing can be turned on its side. It can be turned completely on the roof. That can mimic a rollover. The dimensions are almost perfect to spec as far as your working environment, confined space, utilizing the appropriate skills that you'll be taught. Backboarding, short backboard, it does its job. You can kind of see a student when they first get introduced to this, they seem it's not possible to get someone out here without furthering injury. By the end of that block, it's almost, you can do it in your sleep. You gain the confidence. So this room here is our what we call a makeshift apartment, or some type of living space. You guys can see we kind of have a love seat, a recliner. This room will be set up with different types of props, different types of mannequins. As I mentioned before, you as the student may be asked to act of the particular illness or traumatic injury. So we can kind of do anything. What limits my imagination or your instructor's imagination, from finding down to someone unconscious, unresponsive in the bed, which is common in the pre-hospital setting. The Murphy bed kind of sits up, folds in just like a typical bed. And then if you kind of come over here to the bathroom, super common in the pre-hospital setting. Patients, whether it be a traumatic injury that they fell, or maybe they had a heart attack in the bathroom. Again, this kind of brings simulation to practical approach, real-world approach. So again, as a student, you could be asked to act a certain scenario, or we have a high-fidelity mannequin that we bring in, and then again, it's all trying to get you familiar with walking into strangers' homes, seeing different paraphernalia that might be around, different objects. We try to bring the real world into the classroom through simulation. Okay, I'd like to show you our simulation ambulance. This is one of my favorite props that we have here at UNM-Los Alamos. Again, I showed you the apartment. We started in the classroom. I showed you the apartment where the simulation would take place. Again, the transport process from the house now into the ambulance. Some of these patients need management en route to the hospital. We don't want, when you go out to the field, to not know what ambulances look like, not know what it feels like to be in there. So everything in here is designed almost to spec on how the fire department here in Los Alamos has it. As far as where we place stuff, the dimensions between the gurney, the bed, and the bench seat, and all that. And everything is supposed to be, obviously, other than it moving, it's just exactly what you'll see in the field. So you step up, you have your airway chair. Again, a student or a high fidelity mannequin would be here, and then we would manage that patient en route. Obviously dictated and time-stamped by your instructor to kind of give you that real-world experience, whether it be a 15-minute transport time or a quick 2 to 3 minute transport time. Again, trying to bring the field to the classroom. So next, I'd like to show you what we call our emergency room. Again, simulation emergency room. Everything is kind of built as close as we could to spec on what you would find in a typical emergency room. So, like we talked about, classroom, we learn in the classroom. We do practical application in the field, the apartment. We start the transport process into the ambulance. Obviously, we have to do a patient turnover and maintain that continuity of care onto the ER staff. So as we come in here to this makeshift ER, we have what we would call a crash cart. If we wanted to expand that scenario, sometimes you have to work directly with the ER staff, and we don't want you to be the first time that you see a crash cart. We don't want this to be the first time how to operate an ER bed. Much different than what you see in the pre-hospital setting. So everything, again, is brought back to the simulation to mimic reality. Over here we have what we call a high fidelity mannequin. This one I have set up here in the ER bed. One thing I wanted to point out with this mannequin, it does blood pressure. We can talk through it, so it can talk to you, answer your interview questions, mimic the condition of the scenario. And then when we talk about simulation, I kind of wanted to point out these cameras. In each simulation room, we have these cameras, and your instructors are in a different room, listening, recording, and then kind of giving you that real overall approach, and then we could watch it later and say, yeah, absolutely, you forgot this, or good job on this, this is what I like. This mannequin, our simulation rooms with these cameras kind of brings that experience all together for the learning environment. Hopefully all of you guys enjoyed the virtual tour. I just wanted to highlight a few things as far as what we offer here at UNM-Los Alamos. Pretty much every semester we'll have one type of certification process going on, sometimes both. Again, from the emergency medical responder, which is kind of the very, very, very first tier, to the EMT, and then to the advanced EMT. Our goal here, as I mentioned before, is to set you up for taking the National Registry exam, which is your certification process, prepare you for the next level, and then we also would like to prepare you for the EMS Academy, which is in UNM Albuquerque, for the paramedic program. We take pride in our students as far as their ability to succeed at the next level and operate in the field. So register. The minimum requirements for an EMT is 18 years of age, high school diploma or GED equivalent, and then we do everything from there, from the ground up. And again, this is not just for the pre-hospital people. This is for people that maybe want to use this licensure certification to work in the ER and move up through the medical ladder, as they say.